Psychoanalysis and philosophy. I fear love. We'll be dealing with this subject today. This subject is not at the center of psychoanalysis, but a very important subject, very common in ordinary life also, common in the area of pathology also, and something that psychoanalysis always has kept itself away from. I made another video on this point, erosion chains in psychoanalysis, where I said, after Freud said psychoanalysis is a cure through love, the idea of cure through love, resistance to love, fear of love, except for Eric Fromm, very few people have elaborated on this aspect of fear of love, of inability to love. And how this impacts quality of life, development of pathology, therapy, healing of pathology, and how spirituality and holistic healing engage with this area. So let us look into this area in a deeper way. Title seems a bit counterintuitive. Most of us seek love. We have seen people seeking love. We see people in relationships of love of different types. And therefore, the point that we can have a fear of love is something that seems very counterintuitive and difficult to believe. But it is a profound truth that it exists in many people to different intensities, and in many cases to the extent of causing or perpetuating pathology, or to the extent of degrading the quality of life. So love is something we all seek, and yet at times there can be a fear of love or avoidance of love. So fear of love or avoidance of love can manifest itself in many ways. It may be avoidance of relationships or number of relationships or closeness in relationships. And this seems very counterintuitive. Although it exists, it's very clear. If we see around, we can see many people suffering from this. Or if not suffering, at least this is active in their lives. And they may not have pathology, but definitely a reduction in the quality of life. Counterintuitive as it may seem, because we see the desire of love as a very natural desire, both in children and adults. And we see the search for unconditional love as the central surge for most human beings. If not the only central surge, at least one of the few central surges that we have. We also see people sacrificing for the sake of love. We see crimes of passion being committed for love. And we also see people working hard to please those that they love directly or indirectly. Most people in the world work very hard to earn and they do it because they love their family members or people around them. Professionals working in non-profit organizations also love their ideologies, their goals, and the people they serve. Freud talked about psychoanalysis as being essentially a cure through love. And what he had in mind was, if adequate love was shown, it itself cures. Second, it provides a safe atmosphere in which the person is able to move towards the goal of healing. And third, in the two model theory of aggression and libido, love sort of neutralizes the current of aggression. So there is a current of aggression neutralized by the current of love. And Freud talks somewhere that anger can be neutralized only by love. So love was central to psychoanalysis and Freud at one point. After that, the cure for love went onto the sidelines, and we went more into the model of the mind, into analysis of defenses and resistances, and catharsis. If we look at art, much of art revolves around the theme of love, the success in love, the failure in love, and so on. So it looks very counterintuitive that we should have a fear of love, because everyone seeks it all the time from birth to death, and we seek it in various colors and flavors. It's not a monochromatic entity. We seek it in through various colors and flavors, and it is one of those things where we don't want to be exact. We want to keep it amorphous and partly unknown, partly enigmatic, so that it retains that esoteric mystery around it and continues to be fascinating to us. This is the background in which we realize that although it is counterintuitive, it's a profound truth that most of us fear love. Not most of us, a substantial group of people fear love. Let us look at what is this fear about and how does this fear manifest in all its colors and flavors. So going deeper and deconstructing this theme of fear of love into its constituents and various manifestations. Fear of love can be understood as partly, in some cases, arising from fear of the one who loves. And two childhood entities come up here: the childhood experience of abandonment and the childhood experience of attack. And this abandonment and attack, abandonment relates to object loss and attack relates to the presence of a bad object. And this creates one of the reasons for the fear of love in the adult, that in childhood they experienced the pain of abandonment and the pain of attack, either of them or both of them. So this can be one reason why there is a fear of love. And therefore one of the manifestations is that in relationships people fear abandonment or attack, and therefore they fear the deepening or closeness developing in the relationship, and thereby they develop a fear of love at the macro level, which at the micro level is a fear of abandonment or attack. Second, people develop fear of love and they fear that they will get trapped in the relationship and they will be suffocated. They can't come out. So apart from abandonment and attack, there is a third fear, that there will be abandonment or attack. Coupled with it, there will be an entrapment from which we cannot come out. So abandonment and attack goes on. and yet you are helpless to come out of it or put an end to that abandonment and attack. So the fear of closeness often is the result of these three things: the fear of abandonment, the fear of attack, and the fear of entrapment. That I will be entrapped in that situation of abandonment and attack, and I will be helpless, I won't be able to come out. And this has to do with the entrapment in childhood with the parents, because the child is entrapped for survival with the parents. There is no way the child can come out if the parents perpetuate abandonment and attack. Till the child grows up, he has to live through that entrapment. And this entrapment is a trap where we feel suffocated. And over a long period of time, you start learning how to deal with all that is arising inside. And mostly it is either somatization or it is deflection onto somebody else. But this is a very real fear for people with difficult childhood, the fear of closeness, because there we have three fears: fear of abandonment, fear of attack, and the fear of entrapment. And often, if you have lived through this entrapment for a very long time, this becomes what I call the tragic holding state. Meaning, it is a state which is both tragic and holding. It is tragic because you suffer abandonment, attack, and entrapment. But you realize that you have been in this state for a long time and you have survived. And to some extent, you have grown also, whatever you have grown, academically, professionally, personally. And therefore, this state is not a zero-sum state. I mean, it's not a zero state. You do get something out of the state. You survive, you grow in certain cases, and you do experience some form of happiness, even though it's on a lesser scale. So then what happens is people fear getting out of this state, although this state is a tragic state. But the fear of getting out of it and going into the healthy state, which to a person who is in this state seems like an unknown, because all his childhood he has been in the tragic holding state. That the parents provide security, they provide food, and they provide means and some help to develop in certain areas, but they are constantly in the mode of abandonment and attack, and you feel entrapped in that. So you have this entrapment where you have abandonment, you have attack, and you also have certain security and certain means of growth and some amount of happiness, not much, but some amount of happiness. And this is a very ambivalent state. We should use the word multi-ambivalent, so to say. And a person who has always lived in this state, he by and large resigns to this state and finds it difficult to conceive of an alternative healthy state and to move there. And it takes quite some time before one is able to make up the mind completely to say goodbye to this state and take to a new healthy state. So this state for many becomes a state for much of the adult life before they are able to resolve to get out of it and to get out of it. And this is what I call the tragic holding state. Simultaneously, a tragic state and a holding state. Holding is very less. If you do the cost benefit analysis of the tragic holding state, it is a loss-making enterprise. But the revenue is not zero. Just that the cost is too high compared to the revenue. Third aspect of fear of love is the fear of oneself in love. In the sense, for a group of people, allowing themselves to go deeper into love brings up deep-seated feelings and ideas about aggression and sexuality, which they have kept away in their conscious. They don't want to look at it. It's not comfortable to look at it. At times it may be with a psychotic flavor. At times the intensity may be too high. At times it may be morally unacceptable. It is just too much to look at. And therefore, there is a fear of touching oneself deeply in love out of the fear of what it activates inside, deep into the unconscious related to aggression and sexuality. There is another unconscious fear of going deep in love, and that has to do with fusion. There is the fear of fusing with the other person and thereby allowing the disintegration of the ego. And this creates disintegration anxiety, and in some, an annihilation anxiety much deeper even than the disintegration anxiety. And therefore, fear of love has to do with lot of fears related to material in the unconscious getting activated and coming up. The fear also is they may take hold of the mind completely and make one do things which are completely crazy. Fourth component fear is the fear of the world around. That if you go deeper in love and everyone knows about it, there will be attacks on you, explicit or implicit. And these attacks generate shame, guilt. There is envy of everyone else because you are deeply in love. And the group around you threatens you with abandonment and attack. So the group around you creates shame and guilt in you. The group has envy towards you. Envy gives rise to rage, desire to destroy, and that in turn leads to abandonment and attack, or either of them or both. And this is the fear of society, the fear of group where you are. So this is a social fear related, or rather that is a component fear of the fear of love. The fifth fear is the fear of going crazy in love, that one may not be able to just control or put a brake or have a clutch, and one may just go full speed and end up thinking things, feeling things, doing things which later one would regret. Practically, it may cost you dearly, and later you may regret, or you may have guilt or shame. So there is a fear of going crazy in love, and there is also a fear that in a pathological, medical sense, one may actually go crazy and cross that line from normalcy to psychosis in this flow of love, this irresistible, strong flow of love. There is sixth, a fear of love itself, the state, because in a group, there is often a template that love brings pain. So after love, an attack will come and pain will happen. The opposite template also happens in case of masochism. Pain brings love. So when pain brings love, that goes into masochism. When the template is love brings pain, it is the fear of pain, fear of love. That after love, an attack will come. There is a catastrophic thinking involved here that good things can't continue for long. That distress is a rule and good state is an exception. And the good state has to come to an end very soon to be replaced by a state of distress where one has to suffer. So celebration is an exception and suffering is the rule. If that is the template, there is a fear of love because it's going to be short-lived and to be succeeded by intense attack of some kind. And over a long period of time, you start developing the love of fear, that you are so used to it that you have ambivalent relationship with fear, and you find very difficult to get out of being with that fear and getting into a healthy state. So there is a fear of unknown and there is an entrapment in the tragic holding state. So all these are components which are associated with the overall fear of love. So we have seen the normal situation, the counterintuitive fact that fear of love is a very common fear. Then we saw what are the colors and flavors in which the fear of love manifests itself. And now let us look at how the fear of love manifests itself in pathology, something we would deal with in psychiatry, psychoanalysis, and psychotherapy. So, fear of love in pathology. First, we can take up some personality disorders. We can start with personality disorders, and we can see fear of love very clearly if we do deep enough therapy of personality disorders. In avoidant personality disorder, it's very clear. The fear of love, the fear of being judged, the fear of being attacked, the fear of being abandoned. Abandonment and attack are common to most personality disorders. Just a question of time before they come up in therapy. They may come up upfront or they may come up later. They may be in the front, they may be in the back. They may be the central issues, they may be the marginal issues, but inevitably they come up. So avoidant personality disorder is the first one, where we see the fear of love makes the person avoid people. This is not the only reason, many other reasons for avoiding people. It may have to do with inferiority, of being mocked at, of I am not good enough, and many other reasons. But today we'll focus only on the fear of love. So in avoidant personality disorders, we see fear of love. In schizoid personality disorder, we see fear of love. In narcissistic personality disorder, also we see fear of love. In borderline personality disorder, also we see the fear of love. In histrionic personality disorder, I have not put it there, but in histrionic personality disorder, also we see the fear of love. In different personality disorders, we see the manifestation differently. But in all of them, there is a fear of emotional closeness. There is no doubt about it. There is a fear of deep emotional closeness in all the personality disorders. Groups which suffer from each of the personality disorders, they manage this fear of closeness, of which fear of love is a very strong component. They all manage the fear of love differently. But all personality disorders, by and large, have fear of love deep in the mind. The avoidant manages it very explicitly by avoiding people and avoiding the development of love and closeness. He feels fearful of every human contact. He feels the love that he needs may just not be available. Instead, attack will come. A schizoid person has given up and recoiled into himself. In case of narcissism, it is different. With dependent personalities, the narcissist does not have the fear of love. But with other personalities, the narcissist has a fear of love. And in case of narcissism, in the outer world, there is an intense fear of love. But in the inner world, the fear of love is not so much. So there are very intense relationships inside the mind, but not in the outer world. In the borderline personality, there is some mistake. Addiction too should not be there. In borderline personality, the fear is of developing closeness. And so an eruption happens if the closeness is seen to be too difficult for comfort. In histrionic personality, also there is a fear of closeness, so there is hopping from one relationship to another. So you have this paradox in the histrionic personality, intense desire for closeness and intense fear of closeness, intense desire for love and an intense fear of love. In many cases of addiction, particularly sexual addiction and addiction of alcohol, we see deep-seated fear of love, where there is a difficulty of closeness and internalization of a good, reliable, stable object, consequently too much of anxiety. And the escape from the anxiety is into addiction. The escape from pain in some cases is into addiction. The escape from humiliation is in many cases in the form of an addiction. We also see in eruptive disorders, in violent patients, the fear of love is very high. And therefore, the aggression cannot be neutralized by love or any positive affect. So whenever we have excessive aggressiveness and an aggression related pathology, any violence related pathology, there is a deep seated fear of love and closeness and a non-readiness to experience love and allow it to develop and neutralize the aggressive current. We see in case of sadism and masochism also a fear of love and closeness. So apart from the fear of sexuality, adult sexuality, there is also in most cases a fear of love in sadism and masochism. In masochism, there can at times be not a fear of love, but a template that pain brings love. In those cases of masochism, there is no fear of love. There is just a template, pain brings love. But in many cases of masochism, there is also a fear of love. In sadism, most of the times there is a fear of love, where the closeness is avoided by aggression. Just as the adult sexuality is also avoided by sadomasochism. So sadism and masochism, there is a fear of love, there is a fear of closeness, and obviously there is a Oedipal problem, all the three together. When there is a fear of affect in general, there is a fear of love in particular also. And this happens when a sensitive person in the unconscious mind finds himself repeatedly hurt. And over a period of time, one starts distancing from love in specific and all affects in general. And one slowly develops what is called the isolation of affect. It may lead to a stunted or a blunt affect state, but at least there is an isolation of affect slowly building up. And when that happens, one of the important elements is avoidance of art, because art provokes, activates affect. So slowly one moves away from watching movies, watching music, videos, reading novels, anything that can provoke feeling, and art provokes feeling. So avoidance of art is a very important element that can give us a hint about fear of love or fear of affect in general. Fear of love in pathology is also seen. Avoidance of art is not really pathology. I should not have listed it here. Uh, it broadly refers to reduction of quality of life, but it is not a pathology, should not be here. Avoidance of adequate object relations. That is a pathological element. So in this pathology also the fear of love is shown, that you are not able to get close to anybody, and this creates two things. One, if at interpersonal level you are lonely, and loneliness gives rise to a series of psychosomatic problems. Not only psychosomatic problems, purely psychological problems like depression also. And second, avoidance of adequate object relations because of the fear of love or closeness can also create social group inadequacy. In the sense, it's a social impairment. You are not able to be as social as normally one should be. So when you are in trouble, the social help which should be coming does not come. And this social group impairment, the social group inadequacy can be centered in the fear of love. In therapy, the fear of love, fear of closeness comes up in the relationship with the therapist. A person with a fear of love may not be able to create a strong bond, a strong relationship with the therapist, and that has a very adverse impact on the therapy process itself. It has many difficult things which happen in therapy, but one central problem is, one of the core goals in therapy is internalization of a good object, a good, reliable, stable object, a stable, predictable, positive object. And that does not happen because you refuse to get close to the therapist because you fear love. And that either makes the therapy too long or it reduces the impact the therapy can have. So in the area of pathology, these are the ways in which the fear of love manifests itself. It is found in a variety of pathologies listed in DSM. It is found in variety of pathological situations stated as pathological by psychoanalysis. It is also responsible for social inadequacy and social impairment. It is also responsible for reduction in the quality of life. So these are the pathological manifestations in the broader sense of the word of fear of love. Let us now come to how psychoanalysis sees the causation of the fear of love. Where does it come from? Why should anyone develop a fear of love? What happens in childhood that you develop this fear of love? What are the points in childhood where the fear of love can be developed? What are the phenomena where that have happened in the childhood, either in the external world or the internal world, because of which the fear of love has developed? So let us look at various schools of psychoanalysis and what each of them has to say about the development of fear of love. Early in life, the child attaches very intensely to, first to the breast, then to the mother as a person, and then to the father as a person. And in this attachment, if the child experiences pain in any form, pain of deprivation, pain of abandonment, pain of attack, pain of seeing a person who is not warm, pain of absence of people, any sort of pain, any sort does not mean pain at all, but if pain is substantially felt, far more than the pleasure, then the child can develop a fear of love, because the template there is love brings pain. So you start fearing love. So this can be in relation to the breast. in very early life. Thereafter, the child starts recognizing that breast is a part of a person called the mother, and therefore the child now relates to the mother, and there the pain can be in relation to the mother or the father later on. So chronologically, the first relation is to the breast, second to the mother, third to the father. And in any of the relationships or multiplicity of these relationships, a child can develop a template of fear of love. So this would be in the first 2 years of the age. Then moving forward between 4 to 5, or some people even call it 2.5, but mostly 4 to 5. The Oedipal triangle sets up, and the Oedipal triangle is a triangle which is resolved in a very painful way by giving up an object of desire, and this creates pain. So love can lead to pain is an inevitable outcome of the resolution of the Oedipus complex. And if it is too unbearable because emotions generated are too much, or the ego strength to handle emotions is too low, then fear of love can also be generated in the Oedipus. For a long period of time, how the mother acts with the child or the father acts with the child, the good enough mothering, or we can more generally say good enough parenting, that is very important after 5 years of age till 12 years of age, the pre-puberty time, where also the fear of love can develop. If good enough parenting is not available, if there is stress in the environment, violence in the environment, attack or abandonment in the environment. Experience with the teachers, friends in school is very important. The child attaches and goes out with the emotion of love towards teachers and friends. And if in that attempt, child does not get reciprocation of love, reciprocation of good feelings, but instead gets attack or instead gets negative feelings to feel. Feelings like pain, shame, guilt, envy. If these are the feelings that develop in that attempt to relate, a fear of love develops. Some children have parents who have jobs which are very transferable, so to say. And they have to undergo the school change. School change is a very traumatic thing. The child develops intense relationships with friends and teachers, and then the attachments are broken, extremely painful, and the child moves to a new place. Again, attachments are developed, broken, very painful, third school. After some time, the child stops developing attachment, and everything becomes unconscious and repressed. And the pain and the anger of every breaking of attachment is piled up in the unconscious, heaped up in the unconscious. So this also creates a template of fear of love or fear of attachment. Going crazy in love, the ego losing all the control of the psychic system. The ecstasy being so high that one can do acts which can result in loss, self-destruction, or later regret, pain, guilt, or shame. It's almost like love is seen as a manic experience, and one is afraid of what consequences of that manic phase will be when one comes out of that manic phase and looks back. So going crazy in love is a very real fear which leads to fear of love. The effervescence and the energy that love generates, that leads often in some people to disintegration anxiety. The ego is not clear if it can manage that level of effervescence, and therefore there is a disintegration anxiety. And this also creates the fear of love, because the moment love becomes very intense, the effervescence rises. And with that effervescence, the disintegration anxiety also rises. One more fear is related to this intense emotion pulling up from the unconscious mind, very difficult to process entities. They may deal with the very early life Kleinian unconscious fantasies, which may be pre-linguistic in their chronological genesis. It may be archetypal images of early life. It may be a very confusing collage of ideas, visuals, feelings, which are very difficult to process and very anxiety provoking. So intense love can pull up those things, and that also creates anxiety and fear of love. One more fear is the fear of responsibility and the trap of love. That love can lead to moral, social, and legal consequences in the cultural situation where one is. And therefore, one wants to avoid love out of very practical consequences that would follow love. And in many societies, it is the fear of getting married to somebody, where the idea is that there is an intense temporal love but no long-term compatibility, or the objectives of life are different, or the value system is different, or the search is different. So intense love is for somebody who is not seen as a long-term compatible person, and there the fear is of getting trapped out of moral, social, or legal issues. At times there is a fear of love because too much of it can lead to two things. One, too much of it can lead to the attrition of superego or the weakening of superego. So where love is, superego finds it very difficult to operate itself. Love is sort of something that dilutes the superego, the harshness of the superego. And it's very difficult in the practical situation often to go into a situation without a very sharp and a strong superego. So everything is necessary in life, including when necessary to use the instruments of anger and pain. And this is blunted by too much of love towards an object. So where superego has to function, the harsh part of the superego, or where aggression has to function, that you want to do high volume of work or difficult kind of work, and aggression is necessary, very high aggression is necessary. In such situations, too much of love is detrimental to the goals. So in certain rare occasions, there is a fear of love out of the fear that superego will be weakened, or the aggressive power to work or achieve certain goals will be weakened. It's a very true practical situation that it is indeed so, that in certain situations too much of love is counterproductive in the practical situation. If you are a believer, then if you go outside of psychoanalysis, then two more elements come in. One, the karmic accumulation can lead to a fear of love, because the idea there is that in past lives experiences happened where love brought pain, love brought difficulty, or in this birth the primary goal is to experience something other than love, and love has to be kept to a minimum. and therefore the fear of love is at the service of individuation of a particular type. And therefore the individuation of the individual involves high degree of productivity, creativity and happiness unrelated to love or less related to love. So that being the goal of the self, and that being the uh, endowment of karmic baggage from the past. So either because of individuation or karmic baggage of the past, uh, one may have a fear of love, and that may be a very productive fear of love, very aligned to one's individuation. That's a very different way of looking at the fear of love as something positive. In one of the videos, I have talked about the productivity of pathology. And this is one of those areas where the pathology also has a productive aspect to it. That were it not for that pathology, 100 things that the person has done in the life, he would not have been able to do had it not been for the pathology. So pathology in one area can make you concentrate yourself in the other area and then become a high achiever in that area. So this is not a psychoanalytic thing. This is more like if you believe in spiritual psychology. But this is one more aspect to look into it or consider at least. And psychoanalysis says hate generates far more energy than love. And this is true in general also. Psychoanalysis does not have to say it. And this energy may be necessary if the situation demands aggression. And in such situation, love can be a weakening entity. At some occasions, love can actually be a strengthening entity. For example, someone from the family is being attacked, a lot of energy is generated to save that person. But in more cases than less, hate generates far more energy than love. In some cases, of course, love generates more energy than hate, but in more cases than, the rule is hate generates more energy than love. Exception is love generates more energy than hate. So if that energy is needed for some purpose, then there is a fear of love which is natural. That it can be a entity that weakens, that takes away, subtracts rather than adds. So if we look at the causation of the fear of love, the psychoanalytic love story below the fear of love, there are all these aspects that we have to go into. And of course, all of them come up in therapy, and different aspects are emphasized by different schools in psychoanalysis. Like if you look at the first one, the first pain generated in love with the breast mother and father is very Kleinian. Oedipus is very Freudian. Good enough mothering is very Winnicottian. How does psychoanalysis go into healing of the fear of love? The therapist offers a good enough relationship to the patient, and the patient experiences a stable relationship, a solid relationship, a predictable relationship because of the frame of therapy, and a holding relationship because of the training of the therapist. This provides the person with a good enough relationship, and that leads to the healing of the fear of love. So one element in healing the fear of love is the experience of a good enough relationship with the therapist. And this may take time. A person coming with relationship problems, as most of the patients do, it takes time before trust is developed, familiarity is developed, and one is ready to take the risk of entering into a good enough relationship. And once one enters and experiences, it changes internal system to some extent, And over a long period of time with sustained experience, deeper changes happen, leads to healing of the fear of love. It is not an event thing, it is a over a period of time thing that happens. It happens by repetition, by a cyclical appearance and going away. So it's an extended period phenomena. It's not a one-time event phenomena. Cohesion therapists, they offer self-object experiences, and that allows the person to overcome the fear of love and be ready for closeness. So self-object experiences are offered by the therapist, where the patient can experience the therapist as an extended part of himself. And this childhood desire, which has never been satisfied, is satisfied, and development which was arrested is restarted. And the self-object experiences are offered more by omission rather than by commission. The selfless presence of the therapist also provides safety to the person and the positive ideal presence for the person to bite into and internalize that idealization and thereby enhance the strength of the superego. The therapist should not have a personal investment in the outcome of any discussion that he does. This selfless presence creates a different experience of safety, of neutrality, of positivity, and that helps the person to relate to the therapist even more. And in that relationship and developing closeness and attachment, overcome the fear of love. The unconditional presence is also important. In the sense, the therapist does not bring in his own value system, and the acceptance and the discussions are as unconditional as possible. The acceptance and the discussions are as unconditional as possible. This creates an unconditional presence. It cannot be stressed enough how important it is, the unconditional presence. If the presence becomes conditional, expression is repressed. And without expression, psychoanalytic psychotherapy can't go far. Containment also is very important. It's a Bayesian concept, very important concept. For many patients, this is the most important element that most therapists miss. That there are sessions where the patient only wants to be contained, he does not really want any interpretation. He does not want any direction, does not want any guidance, any knowledge. He just wants to be contained. And this containment is very important. And this containment can happen not only by withdrawal of acts of commission, by refraining from intervention, leave alone interpretation. Not only from refraining from intervention, but by creating a positive state into oneself. Because when the therapist creates a positive, all-containing state in himself, the state transfers by transference from the therapist to the patient. This is a very elusive and esoteric thing, but it happens. That the counter transference from the patient immediately makes its presence in the therapist. So just as we say there are two transferences and two counter transferences, the counter transference from the patient immediately makes a different impression, different feeling with the therapist. The moment the therapist himself goes into a, a peaceful, containing state, as much without thoughts and feelings as possible, as much without agitation as possible. And this containing is very important. This develops the ego strength in the patient, and this develops the positive belief that he does not have to fear love. He does not have to fear relating to people, expressing to people. A very important element of healing, therefore, is containment. And the containment is of two types. One is a passive containment where you just contain, and there is an active containment where you give back something that you contain. A negative thing comes to you, you contain it, you transform it and give it back as a positive. A concrete example can be a small child crying and beating the mother, and the mother smiles back at him. So the child puts his aggression into the mother, irritation and agitation into the mother, and the mother processes it and gives back as a smile to the child. So this is a very good example of active containment, something more than ordinary containment. Analysis of fear of love itself helps in overcoming the fear of love, because it becomes obvious to the person, it comes up to the surface, it is brought to the notice of the person can see it, reflect upon it, understand it, and this leads to the cost benefit analysis. Then it becomes clear to the person what is the cost he is paying and what benefits he is not getting because of this fear of love. And this cognitive part of the whole approach marshals the will to overcome, and the will slowly becomes more integral, where the desire to change becomes strong. One becomes convinced, and even this intellectual conviction gives some relief to the person, may not be major relief, maybe 5%, 10%, but still some relief to the person, because he knows what is troubling him and what is the cost and benefit of continuing with the pathology or healing the pathology. When the person narrates what happened today or day before or some years back, some event is narrated and fear of love is implicit in that event, the therapist interprets the fear of love implicit in that event, and this happens many times over, and every time the interpretation goes in and strikes the person, and over a period of time the transformation happens. That the interpretations made, repeatedly made, make a dent, and the interpretations apart from many other elements also help in transformation and healing. Catharsis, of course, is the most important element of the whole list. There are two important elements, catharsis and internalization of a good object. When we talked about the good enough relationship, stable, solid, predictable, holding relationship, unconditional relationship, containing relationship, self-object relationship, selfless presence relationship, all of these elements create a situation where the unconscious mind of the patient is ready to internalize the good, stable, reliable object of the therapist into himself. And the early life inability to internalize a good, reliable, stable object is now fulfilled. And that is a great advance in healing. So internalization of good, reliable, stable object and catharsis of accumulated emotions from childhood. These two are very important elements of the healing process. So in catharsis, by acts of interpretation, by acts of support, by providing the safe enough environment, the person is encouraged to allow the feelings to come up towards very important people in his life, towards various events, towards his success and failures, and allow all these feelings to come up. Anger, guilt, pain are the most important effects to come up. In some cases, we are dealing with severe envy, inferiority. In some cases, anger below inferiority. And in some cases, a fixation in fear itself. So when we say catharsis, we cover by this word not only release of anger, pain and guilt, but we also cover by this word in a loose way problems related to inferiority, envy and fixation in past fear. So we look at here anxiety in two ways: signal anxiety, which is a cover for other affects, and anxiety which is related to fixation of some event of the past where significant amount of anxiety was produced. So we look at anxiety as in two ways: general anxiety and signal anxiety. So when we say catharsis, we not only refer to release of anger, pain and guilt, we also relate to problems of shame, inferiority, envy and fixation in past anxiety. One more element of healing is the capacity to receive and give that the patient develops over a long period of time. And of course, this fear of love is moderate to long therapy. It is not a short therapy question at all. So we are looking at 1 to 3 years of time. We are not looking at 3 to 4 months of therapy. With all these elements of healing in psychoanalysis, slowly the person comes to realize love is safe and it is safe to love. And one becomes capable, for what Eric Fromm says, to love, to be loved and to be in a state of love. So is healing done in psychoanalysis. How about holistic healing and spirituality? In holistic healing, we have many options. Each of the approaches tries to heal the fear of love in a different way. In pranic healing, fear associated with the heart chakra is cleaned out and the heart chakra is, or the back heart chakra is energized with positivity and good feelings, with good energies. Mostly they use whitish pink or they use intentions or blessings. So pranic healing has its own way of dealing with fear of love by cutting the cord of the fear center with the heart center. Pranic psychotherapy can also be used there, is being used by those who practice that art. Homeopathy has its own way of dealing with fear of many emotions and they use potentialized medications. yoga has its own ways of pranayam, particularly Anulom Vilom and many other ways of pranayam to clean up the emotional system. Hatha yoga also has some approaches to cleaning of each of the centers, and that includes the heart center where the fear of love is situated. It's not situated there, it is felt there. I'm not sure where it's situated, it may be in the Muladhara, but it is felt there. The fear of abandonment and attack is most distinctly felt in the heart center. If not by everyone, by at least a large group of people. Visualization techniques are used in holistic healing, where you are relating to somebody and it is safe, continues for a long time without any attack or abandonment. Stories are used, guided visualization is used, free visualization is used. Some people also use hypnosis for attaining the same goal of removing the fear of love. Mantra practices are used. Certain specific mantras are recited to clear up the heart center, the front heart and the back heart center. So that is one more approach to overcoming the difficulties of the heart center, including the fear of love. Spirituality has a different take on this. Spirituality uses, of course, there is an overlap between holistic healing and spirituality. Many of the techniques are common to both. Many of the approaches are common to both. But strictly speaking, if you want to differentiate, idol therapy is used by spirituality to overcome the fear of love, where you relate to the idol by creating the personality of the idol in your mind, by associating stories with that idol, and then the relationship develops. So the fear of relating is overcome, and when the relating develops, all effects come up, including love, and then it is dealt with in a particular way. There are ways of doing the idol therapy in stages. When the attachment is weak, when it is moderately strong, when it is very strong, what to do in those phases, those are details of idol therapy. Very few people know it and practice it, but it's a very important element, at least of the Hindu spirituality, the use of idol therapy. Devotional music is used where one relates to a safe, omnipotent god or goddess in a poetic way with music. So it is art combined with faith, and both constitute a particular practice, and different chakras are managed, evoked, healed, explored using different kind of poetry, song and music. So devotional music can be used, is used for overcoming difficulties of the heart chakra, and that includes the fear of love. Relationship with the guru is almost analogous to that of a therapist, but not the same, very different, but parallel. So relationship with the guru, who is seen as all good, all giving, omnipotent to some extent, that is used to overcome the fear of relating, and that includes the fear of love. Attachment with spiritual comrades, those who are along with us on the same spiritual path, or maybe we share a same guru or the same school, if not the same guru. Relating with them is seen as safer compared to relating with a normal person in the outside world. And this is a very common experience. Individuals who find it difficult to relate to people in the outside world, many of them are easily able to relate to people within the spiritual commune. So relating with spiritual comrades also is one more mode of healing. Practices like avishkara, where one becomes, not becomes, one takes up the role of somebody who is no longer alive and tries to live out his life. And in that living out, if the event involving love is taken up, then that design of this practice of avishkara can be used to overcome the fear of love. How do we see the future evolution of this issue? But we will accept the fear of love more as a central problem than we do today. And we will see the use of love in its for its curative aspect, preventive aspect, and as an emotional supplement during our childhood and our adult ages. We have been talking only about the nutritional supplements in the biological sense. We don't talk about emotional supplements, but we all need it. So just as there are nutritional deficiencies, there are emotional deficiencies. And we need emotional supplements just as we need nutritional supplements. Difficulty is emotional supplements can't be manufactured in factories. It needs an honest person to be giving it, and that's not easy. So first will be recognition of the problem, that this is a problem, very pervasive and central problem, and there is a curative aspect and a preventive aspect to it, and it has to be used as an emotional supplement. Second, there will be a recognition of the fact that spiritual and holistic approaches have valuable, almost priceless treasures to offer in this aspect and many other aspects of healing. So how to integrate them in psychoanalysis? How far do we go? What parts we take? How do we interpret and assimilate in our present framework? Or do we expand our framework? Second important aspect. Third is psychoanalysis itself has a fear of love. That may be one of the reasons that it's an underexplored, underused entity in the psychological world, at least in the psychoanalytic world. And I have put up a video on this aspect. It's titled Lust at First Sight, Heroes in Chains in Psychoanalysis. That explores the fear of love psychoanalysis has and how little we have used this concept and the whole area around love, populated by so many ideas, issues, implications for pathogenesis, implications for healing, implications for model of the mind. So there's a third element that I think will come up, the going near of psychoanalysis to love and overcoming this fear of closeness in relation to love. And of course, the goal here is that one should be free to feel. It's an ideal, it's not something that is easily achieved, easy to say than to do. But the ideal of free to feel, that involves three important aspects. One, how is affect generated? Two, how is it regulated? And that includes expression and regulation. And three, excess affect, if it cannot be regulated, how does it get into symptom formation? So affect generation, affect regulation, symptom formation. And the fourth is, if symptom formation happens, how to go for catharsis. And second, how to stop new affect generation so that one is not in the perpetual loop of catharsis. And once we understand and use well this affect management system, which has three broad areas: affect generation, affect regulation, symptom formation, and then affect release or catharsis. So if we understand and manage well and use well these four stages which constitute together the affect management system, then we can approach near to this goal of free to feel. And this is a goal which is both necessary for healing for those who suffer from pathology and priceless for those who wish to enhance their quality of life and lead a fuller life. Thank you. If you have questions, write to me at hvindia@gmail.com.